you can view it on the Lifesaving Victoria AFAR webpage, and that will be there with all the previous session recordings as well, so you can go back and have a look at those. For our upcoming webinars, we do have a new format and we will be having a short break. So we will be breaking for a couple of weeks until the 8th of July, and we'll then be running our webinars once a month from then on. So the water safety education session will be running from 10:30 till 11, and either side of that we'll have a pool safety session along with a management and leadership session. So just introducing our presenters today, we have RJ, who is the manager in pool safety at Lifesaving Victoria, and Erin Collins, who's the training manager for public training. So I am going to hand over to RJ now. So if you'd like to unmute and share your screen, that would be fabulous. Thanks, RJ.
Good morning, everyone. Can you hear and see me okay there, Michelle?
Yes, we can, RJ. Thank you.
Yeah, and you can see my screen okay?
Yep, all good to go.
Thank you. Thanks for having me. So today I'm talking about the really fun and exciting stuff. I know everyone's really passionate about compliance and safety. That's my contact details up on the screen. If you want to get in touch with myself or the team, the phone number goes through to the office, and our webpage is there as well for a bit of an overview of what we do at Lifesaving Victoria. Compliance, safety, why do we do it? One is we want to keep the little ones coming in for their swim lessons. We want to keep them as safe as possible, obviously. But I wanted to go through today as well a little bit of the responsibilities that underpin what you do as swim teachers, as facility managers, and as learn to swim coordinators and so on and so forth. So I figured I'd give you a couple of case studies. So a lot of us, it's human nature for us to think this won't happen to me or in my swim school or in my swim lesson. But the reality is we don't get to control all of the variables. We don't really get to control the condition that people come into the facilities in. We don't get to control their pre-existing medical conditions or their physical and or psychological and or mental abilities. We only get to control what we can control. So in some cases, there is an element of chance, and so you do want to make sure that you are prepared. So a 3-year-old boy drowns in a swim lesson, charges late over swim school injury, $150,000 fine in Victoria for an injury that happened in a swim class. Teenager drowns during high school swim class, drowning death during swim lesson, toddler, swim school, largest outbreak of waterborne disease after pool wasn't cleaned. And then, of course, commencing in about 2 weeks, Victoria's new workplace manslaughter offences. So anyone that's been sort of paying attention in that space, essentially, if there is a death in a workplace, which learn to swim facilities and public aquatic centres fall into under the category of workplace. Workplace deaths are now going to be investigated in the first instance as a possible manslaughter, which is a significant increase in the consequence and penalties for the owner and operator. So it's talking about negligent conduct. So does not adequately manage, control, or supervise employees, does not take reasonable action to fix a dangerous situation in circumstances where failing to do so causes a high risk of death, serious injury, or serious illness. And the penalties in that space are now enormous: 20 years imprisonment for an individual and $16.5 million fine for body corporates or organizations. So they're the strictest penalties in our country, maybe even the world. And that's something to be aware of. These laws come into effect July 1st, 2020, so 2 weeks. So I'll talk a little bit around the framework. So we have laws, rules made by government, policy, which is things like Australian standards and ISO standards, which are international standards, procedures, so codes of practice from WorkSafe, compliance manuals, that type of thing. Then we have industry guidelines like the Royal Lifesaving Society of Australia guidelines for safe pool operations. We've got the water quality guidelines for public aquatic facilities from the health department. And then we have local documents. So your safe work procedures, your water testing procedures, your risk assessments. Hello, Kieran. How are you? Good to see you. We got your camera on. So, here's an example of a law. In the OHS law, employers have a duty of care to all employees, workers, contractors, and visitors to the worksafe. They have to provide and maintain a safe system of work. They have to implement arrangements for the safe use of chemicals, hazardous substances, maintain the workplace in a safe condition, provide workers and contractors with adequate facilities, ensure workers have adequate information, instruction, training, and supervision, monitor worker health and safety, maintain relevant records, provide workers with information about workplace health and safety. And then employees have a duty of care to themselves and their co-workers, have to cooperate with employers' efforts and attempts to make the workplace safe. They have to perform duties or tasks as per the workplace instructions and training. They have to ensure qualifications are current and maintained. They have to follow workplace policies and procedures, and they have to attend health and safety training if required, and as well as reporting risk and accidents. So these are the statutory obligations, legal responsibilities that employers and employees both have. Under the public health laws, you've got the aquatic facility operator must manage the risks to human health arising from pathogenic microorganisms in the water, and an aquatic facility operator must ensure that the water in the aquatic facility is maintained and tested in the manner set out in the subdivision. So there's a bit of, there's the health regulations as well, two separate legal schemes, both apply with significant penalties if not adhered to. So different responsibilities, but the overlap is that they both carry a duty of care. Further, the next layer down, we're talking about industry documents, standards, guidelines, etc. So I thought I'd talk a little bit around some of the resources that exist. So we've got the Victorian Public Pools State of the Sector Report, which has the goals of raising the profile of the industry to government, highlight challenges and solutions for industry. Some of the key info in that document is the drowning figures, advocacy, research, technology advantages, social value, and economic benefits. So if you're needing to make business cases for compliance and safety to your council or to the higher ups, you can sort of underpin some of that with the resources in that document. There's also the Victorian Water Safety Strategy. So all Learn to Swim facilities, the aquatic industry generally, come under this Victorian Water Safety Strategy that the Victorian government have, with the goals of reducing drowning in children aged 0 to 14, to reduce drowning in pools by strengthening the aquatic industry, and to focus on high-risk populations. And we'll talk a little bit more about that as we go. Then we have here in Victoria the Safer Public Pools Code of Practice. The Code of Practice, the goal is to make compliance easier to understand and to collate resources into one document. Some of the key info in there is the requirement to have pool safety assessments, which is one way of measuring all of the various compliance schemes and frameworks and making it easy to follow. And then the fact that there's a pool register. There is a public pool register, which includes all Learn to Swim facilities in Victoria as a component of this project, as well as a summary of the guidelines for safe pool operations. So the GSPO on a page at the end of that document. Courses are guidelines for safe pool operations, which I'm sure everyone's familiar with. And the goal is to make pool operation safe. The key info for you guys is it specifies the qualifications that swim teachers need to hold. There's key guidance on risk management, the management of swim school. So the supervisor of a swim school program, the qualifications that they need to hold, as well as providing a consistent national industry standard. Royal Lifesaving also have the National Swimming and Water Safety Framework. I believe they presented on the series earlier about that, but the goal is to provide a basis for developing, providing, or selecting an appropriate swimming and water safety program in your facility. And then here in Victoria, we have the Water Quality Guidelines for Public Aquatic Facilities as well, which is to provide further details to compliance with the public health regulations. The key info in there is the aquatic facility registration and the water quality risk management plan. So I'll just move through some of the detail of these. I think it's really important to understand what the current standard of care is that must be met. So in the guidelines for safe pool operations, it talks about supervision, which applies to all pool types, whether it be a caravan park pool, whether it be a hotel pool, a motel pool, an apartment pool, anything that is public or public access. Learn to swims are no exception. Supervision must be in place, and it defines what supervision is. So it's someone that's directed by a set of arrangements within a supervision plan, key document that you must have. They hold a current skill set equivalent to that of a pool lifeguard. So they have to hold something beyond just the swim teacher qualification, in a position to maintain effective supervision of the persons in their zone. So if they're in a class, that's their zone. Able to respond and reach a person in distress in the swimming pool within 30 seconds, and timely access to appropriate rescue equipment, a rescue tube, a spinal board, first aid kit, an oxygen resuscitator, and a defibrillator. The next sort of layer of detail is the development of a supervision plan, which needs to be undertaken through a structured process of identifying and analyzing potential risks. And this is kind of what one would look like. It's a document that covers the facility, and it's something that's workable for the staff. Then you also need to consider those user groups who through draining research, are more prone to need supervision. So culturally and linguistically diverse patrons, children, older Australians, persons with disability or medical conditions, school groups, sporting groups, non-swimmers, weak swimmers, and persons unfamiliar with the environment, aquatic exercise and program groups, parents, carers, guardians, and large groups. So something like a program targeted at vulnerable swimmers, something like that in your facility. Further to that, you need to encourage older people to notify staff at the entrance if they have pre-existing medical conditions. So this is probably applying to recreational swimming or those doing programs, and then implementing policies to encourage patrons with inexperience or vulnerabilities who may be non-swimmers to inform a staff member of their inexperience. So something like a "How well can you swim" card. And I'm sure if you're doing children's lessons, it's kind of a given that they're not necessarily very good swimmers. So you may well have that covered off. There needs to be someone who is nominated, an employee who's responsible for the supervision of swimming and water safety programs. So, typically that would be, a coordinator or a deck supervisor, somebody along those lines. And they need to oversee the development, implementation, monitoring, and continual improvement of the program, its procedures, and the training and professional development activities of staff relevant to the program. That employee needs to meet with the staff at least 4 times a year for a year-end facility. So there's a requirement to meet with the staff that are relevant to the program. The employee supervising swimming and water safety programs at an aquatic facility should hold the following current competencies, and I've highlighted one of those there because I'm not sure if everyone's aware, but the swimming and water safety teacher's skill set does not include SIS-CA QU006, supervised clients in an aquatic location. So that one, as far as I understand, is covered currently in the pool lifeguard course, but it's just that the person, the supervisor or the coordinator, needs to hold a lifeguard qualification as well, or at least hold that particular unit of competency if they can get it through another qualification. So, and they need to participate in a skills currency session of every 12 months as well. Swim teachers, so these are the units of competency that swimming and water safety teachers need to hold: 002, 008, 009, 010, or 010, sorry. And then we have the specialist groups, so the infant and preschool, and the programs for disabled persons. So these are the sort of industry standard qualifications that everyone probably already holds. So there should be nothing there that is new. There are new requirements to have health assessments for swim teachers to make sure that they're inducted, that there's currency and professional development in place, and that they participate in a minimum of 4 for year-end facilities or every 3 months for seasonal facilities, 4 training sessions to ensure currency of necessary skills and competencies. And it must include teaching methodologies, swimming and water safety programs, practice of initiative assessment of and response to simulated incidents, resuscitation, and aquatic rescue techniques. So you have to cover off on those competencies. It's not sort of if you were going to be having to hold up evidence in court, you'd want to make sure that the agenda items cover those competencies. The Safer Public Pools Code of Practice, so it's talking about having pool safety assessments and the frequency of those assessments. So you should consider the risk exposure of your venue. So if you have over 100,000 visits per year, having an assessment every year. If you have 20,000 to 100,000, an assessment every 2 years. If you have under 20,000 patron visits per year, then you only need to be assessed once every 3 years. And then the people that do those assessments need to hold the following qualifications. So they need to hold the BSB AUD 501, 503, 504, which is initiate, lead, and report on a quality audit, or they need to hold the Work Health Safety 606, conduct work health safety audit and evaluate work health safety performance. So they need to hold one of those sets of qualifications. The other one is the aquatic facility operator. So this is the health department standards, which is the minimum standard for aquatic facilities. Would be for staff to undertake a short course offered by an industry body or registered training organization, and that facility managers should ensure that they have adequately trained staff who understand the treatment process and know how to maintain water quality. And then the other requirement is the water quality risk management plan. So all public aquatic facilities, learn to swim facilities included, hospital facilities, they have a facility classification system in that document. Must have a water quality risk management plan in place, and it must include staff roles and responsibilities, description of the facility, all the usual bits and pieces, hazard ID, and risk assessments, control measures. Now, the health department are releasing this week, I believe, templates for those plans. We've also got a template on our website. So if you're not too sure where to start, you can download a template straight off of our website or theirs and go through the process. We've highlighted where you need to insert your own information or where information is standard. So that's to sort of help out a little bit in that space. I think, so we've talked a lot about compliance, yeah? And you can tick all the right boxes and still have incidents, or you can tick none of the boxes and have no incidents. So that's really, so the actual outcomes are what are really important. So what I wanted to talk about on this slide is that essentially you need to have both. You need to have a safe culture. You need to have good processes, good people, but you still need to make sure that you meet the compliance objectives, because those are the ones that can be objectively measured in a court of law. So you still need to have the overarching plan or a series of documents that say we meet these requirements and this is how we do it, and that any ambiguities or uncertainties are explicitly addressed. We're not sure if we meet this requirement. We're not sure if we have the lifeguard skill set, supervising the pool at all times, and you need to seek clarity to make sure that your patrons, your employees, your management, whoever it is, that you have covered off what your risks are, and that you make sure essentially that you filled in any gaps. So the top 3 takeaways, I think, for you guys, if I look at the learn to swim sort of sector, is that someone needs to have the lifeguard skill set during swim lessons. The supervised clients in aquatic locations, unit of competency for the supervisor or the coordinator, whoever oversees the program, and accredited training in water quality management for the aquatic facility operator. So those are sort of the 3 takeaways for everyone here. I've sort of powered through there, and I'd love to take questions. If you're interested in getting a quick summary of everything you need to know, I've just posted in the comments a pool safety on a page link. It's a 1-page summary of where to find the resources that you need and what qualifications people need to hold, et cetera, et cetera. So if you just click that link in the comments, you can it will download a little 1-pager for you in a PDF that you can print off, and it can be a bit of a cheat sheet for you to ensure that you achieve your compliance objectives. So I'm monitoring the chat here. Is there anyone with questions? I've got the lifeguard qual that RJ mentioned. Even if you work at a public pool where lifeguards are already employed, correct, Samantha. So if you've got lifeguards there, then then you don't need to have that for swim teachers because you've got lifeguards there, right? I'm thinking about the learn to swim facilities that don't have lifeguards. But yes, if you work in a council-owned pool that has lifeguards, then correct. Then the swim teachers don't need to hold it because you've got somebody else that holds it. That being said, the supervisor of the program, whoever is responsible for the program, needs to hold it. It could be the deck supervisors, could be the coordinator, could be the duty manager. How you slice and dice it is really up to you, but there is a requirement that somebody holds it. Is it possible to gain supervising in aquatic environment unit without completing a pool lifeguard qualification? Mandy, yes and no. I think so, but you would have to find a provider that offers it as a standalone unit. It might just be that the easiest way to do it is just to go and do a 2-day lifeguard course, having gone through what we call RPL, recognition of prior learning, myself recently. It can be a very lengthy process to sort of evidence that you meet all the requirements just to get a single unit of competency issued. It might just be more cost effective, time efficient to just do the lifeguard course. But I think there are options. You need to go to the Australian Government Skills Training website to find a provider that would issue that unit of competency. Any other questions? Alice, we are working on a bridging course at the moment. Apologies. So we are working on a bridging course for swim teachers to bridge and get that unit of competency, but it's a TBC. So in private swim school situation, there is a need for a lifeguard qualified person all the time. So Karen, there is a need. There is a GSPO requirement for someone to hold the supervised clients in aquatic locations unit of competency at all times. Yeah. And there is a need under the supervision requirements for someone with an equivalent skill set to that of a lifeguard to be supervising. So it's how you meet the requirements is up to you, but those are the requirements. Yes. Any other questions coming through? It's good to see people asking questions. So Karen, I've sent a link to the pool safety in a page document. There is a link to the guidelines for safe pool operations. It's also in the code of practice in the summary GSP on a page, which is on our website for free. You can pull all the qualifications that you need from those two documents. Just really giving a summary of that. Helen, can I ask if there's a requirement or a guideline? So your legal responsibility is to meet the standard of care that you owe as part of your duty of care. It's very broad under the OHS Act. So the standard of care has been applied in Victorian courts as the guidelines for safe pool operations as being the recognized sort of best practice standard and therefore the standard of care. So that is the sort of common law precedence for there being an argument anyways that the that the guidelines are a requirement. That being said, they are guidelines. So it would really depend on what your risk appetite is and and it would depend upon your sort of legal advice. But my recommendation and our recommendation would be that you comply with the guidelines, which are often used in coronial inquests and legal proceedings. I've just looked on the training site, but not too many PLG updates yet. I'm in desperate need to update. So Sharon, our next speaker, Aaron, will be able to speak to that. I think I might be able to hand over. Yep.
I'm just going to butt in a bit. Adding into the lifeguard qual or the SAS qual in private swimming pools, the question I get regularly is, what equipment do they need?
In terms of rescue equipment?
Yep.
It's all in that SV 2.3.2, which was sort of an earlier slide. It's in the code of practice. There's a GSP on a page summary for rescue equipment, but essentially the supervisor needs timely access to a rescue tube, a oxygen resuscitator, a defib, and a spinal board. And they need to know how to use it. That's probably the key metric, is that in some cases, the equipment's been there, but no one's known how to use it. And they've tried to use it without any training, which has caused further injury. So it's something to be mindful of, is that it's not just enough to have the equipment. Everyone needs to know how to use it.
Thank you.
No problems. Happy to hand over. Thanks everyone for listening in. It's great to talk to everyone. You can always give us a ring, look us an email. There's plenty of resources out there. We're happy to help, and let's make our pools as safe as possible, so that everyone goes home having had a really fun lesson, and they go home nice and safe. Thank you.
Thanks, Sergeant. That was a brilliant segue, I think, into Erin's session about training. Heaps of information there. So I think RJ had his contact details up there. If you do still have more questions, you're welcome to send it through to Pool Safety or School Swimming. Otherwise, type it in the chat now, because RJ is still here. We can ask more questions at the end, but otherwise I will hand over to Erin. Thanks, Erin.
Thanks, Michelle. Okay, hi everyone. Hopefully everyone can hear me. If I can get a bit of a thumbs up from someone, just to make sure that everyone can hear me on the screen. Wonderful.
Yep, we can hear you perfectly.
Okay, so what I'm going to do now, thank you very much, RJ, for segueing in so nicely, is I'm actually going to take you all through what is essentially public training and how we can make it a little bit easier to meet some of those requirements. Some of the models that we have delivered, and also some courses you may not be aware of. So just bear with me for a moment. You can see up on the screen, you'll see that these are my contact details. I am the training manager for public training. So statewide, you'll see that we have courses available on our portal, as mentioned in the chat, for all of the courses that we mentioned throughout that last presentation. Now, public training is essentially a registered training organisation. We do have quite a number of different products and services, but I'm just going to focus today on the accredited training piece to try and make it a little bit less daunting on how to meet some of those requirements that RJ mentioned. The reason that we are able to do this is we are an RTO that really does tailor to the aquatics industry. So where we see that there are quite a number of requirements, we tailor our products and services to try and meet those needs in the most flexible and essentially cost efficient way that we can. We deliver across the entire state. We do that privately, we do it publicly. So what you see on the portal is just about a tenth of what you'll actually see behind the scenes with trainers that are travelling out to facilities every single day, just to make sure that we're delivering the courses needed to our clients. We have a number of other organisations who also deliver our courses on our behalf. So you will find there are other organisations that are branded differently, but also deliver the same courses and resources. So sometimes when you contact us, if you are in a regional area, we may have another provider that deliver the same services that I talk about today. We have around about 20,000 or just over 20,000 students that we deliver to annually. And that is essentially across all of our different modes of delivery and different course types. And all of our aquatic courses do actually get industry news subscriptions as a result, just to make sure that you do stay up to date with a lot of the information that RJ has been talking about. So where we do see key information, professional development opportunities, you will be subscribed to newsletters to make sure that you are staying abreast of that information, following on from doing training with us. And it's things like that that make us unique. We, as a, essentially a peak body, we need to make sure that we don't just educate you, but we have ongoing opportunities for you to stay current. During COVID, I'm going to touch on some of the industry discounts that we're going to offer, just to make it more accessible as people do return. It is important that it's feasible for everyone to achieve these things, and we do believe the modes of delivery that we have allow everyone to have access to the training they need to meet those compliance standards. I'm also going to talk about free CPR. I love it when I throw the free in there. It is something that a lot of people may not be aware of. For swim teachers, we do have some unique opportunities to be able to make sure that you are re-qualling your CPR on an annual basis at the most cost-effective way possible. So you can see there we have got a bit of a split of what we are going to focus on. Essentially, the LSV Swim Teacher Handbook. I'm not sure how many people here have seen it, but it breaks down some of those guidelines for safer pool operations requirements, onboarding requirements, licensing requirements, training requirements, and sort of does so in a really nice, clean, step-by-step way. It's something we released last year when we first launched our LSV Swim Teacher course. It's something I've consulted with a number of different swim teachers and clients on, and have had a lot of feedback that it's quite a user-friendly approach to understanding some of the complexities that surround swim teacher training. We also have the LSV Swim Teacher license, essentially your 3-year license that you will need to be a swim teacher. So if you are re-registering your license, you can do so with us. We do recognise essentially all professional development so long as it lines up with the requirements of the guidelines for safer pool operations, the hours that we require, and also essentially the topics that we've talked about in the previous presentation. So that is something that we do offer. All of our new swim teachers who complete training with us actually do get one of those free of charge, which I'll touch on in a moment. And then we also have all of our accredited training suite. Essentially, everything that you saw in the last presentation is something that we offer. Andy mentioned, or Andy Dennis, our General Manager for Public Training and Pool Safety, mentioned we are looking at a bridging course so that you don't need to have the entire pool lifeguard skill sets. There's a nice bridge between the two. But essentially at this point, I'm going to go through the products we do have on offer and that are upcoming release so that everyone is able to meet those requirements immediately. And then as we release new things, if you are doing training with us, you will get those notifications as we release new products. So it's a challenging time at the moment, and I think it's something we need to acknowledge. And what we've done essentially as things have become challenging is we've tried to put so many support mechanisms in place just to make sure that people are staying up to date, staying current, but also have the things they need to keep moving. So we've only just returned to face-to-face training, and we have had a number of different models of delivery, which I'll touch on shortly. But the moment that we have returned to face-to-face training, we looked at some of those challenges financially for the industry and how we could best support that. And this model that you're looking at here is what I'm going to talk about. So when we focus on new swim teachers, the first thing that you need to do is you need to complete your qualifications. So what Lifesaving Victoria has done is essentially offered a 25% discount off the LSV Swim Teacher course, which sits just above the $240 mark now. That essentially allows people who are looking to upskill, change industries, make sure that they are afforded opportunities. That is pretty much the lowest price point we've ever offered for that course. I mentioned already that you do get 3 years free licensing when you do a swim teacher course with LSV. And then in addition to that, you are also going to be able to see, I think that my presentation is not, there you go, you should be able to see it again. So essentially you'll get your 2 years free CPR included in your 3-year license. Now that result makes it very accessible, very cost effective, and time efficient for someone to enter the industry. And that's a really important point of what we're trying to achieve there. Now, for those of you who don't get that first line, you're already an existing swim teacher, don't worry. We still have the free LSV Swim Teacher Handbook for you to review that outlines a lot of those key GSPO requirements in a nice user-friendly approach. We are giving you 25% off the LSV Swim Teacher license at the moment, which does allow you your 2 years free CPR. I'm going to touch on the at-home piece that I've mentioned there in a second. But all essential modes of our CPR courses, and that is the HLT AID 001, provide cardiopulmonary resuscitation for anyone looking for clarification on that. Supervisors and operators, if you're looking at completing your aquatic technical operator course, you can do that with LSV. At the moment, we are offering that course in a 3-day face-to-face capacity. It's also going to soon be available in a blended capacity, much shorter course. It'll be essentially 2 days plus online learning. Alternatively, if you're a supervisor and you're needing to complete your pool lifeguard, you can do that with LSV. We have it in a blended and a face-to-face mode, or you can update your qualifications should you already hold that. And then for those people looking to specialise, So at the moment, we are offering the LSV Teacher of Infant and Toddler course. It has only just been released. We released it just before COVID-19 hit, and now we've re-released it essentially to commence in July. So we are offering 25% off that course. And very, very soon we'll have the Teacher of People with a Disability course will be released. And that, in a nutshell, is everything that you will need. And that's us trying to support the industry to make it really accessible, really flexible, and really time efficient. Now, when we talk about at-home courses, as soon as we stop delivering face-to-face training, we still recognise that there's quite a number of people who still need to have qualifications, even if we aren't able to deliver them in a standard format. So we have continued to do this as we've eased restrictions, primarily because while we have gone back to face-to-face training, there are still a number of people who have not yet done so or haven't gone back to a face-to-face environment for their workplace. This allows you to do your provide cardiopulmonary resuscitation at home. What you'll do is you'll get a set of online learning, you'll get a number of videos, and you'll be able to use your own equipment that we've posted to your house, and you get to keep that equipment. You film yourself doing the practical activities that we outline in the box, and then you submit your videos online. And that is accredited. You do not need to do anything else other than what we've outlined in that course, and we will issue your competencies if you are successful. It is one of the most flexible delivery models we've had available, and something we're hoping to keep long term. And we are investigating opportunities to do so at the moment. So if that's something that, you know, you're in a situation where you want to update your CPR or your first aid, but you're not in a situation where you can go to a workplace, or that you want to go to a face-to-face training facility, that's fine. We do have that opportunity to do it at home. In terms of webinar delivery, this is a short-term course during COVID, but we are actually delivering accredited training in an online interactive environment, just like we're all having right now. You'd have a trainer at the other end, and you'll have a set of online learning, and that allows you to interact in a live environment while also completing your competencies and not, you know, having to go into a workplace or a training facility. So, you know, for those people looking for that space, that is an option for private courses. And something that we'll continue to offer until we essentially go back to business as usual. Now, for anyone who has jumped onto our training portal recently, you will see a number of courses that say the word blended, and I think it's a good opportunity for me at this point to actually explain what blended means. It's a term we use in vet sector training where it's a mixture of online learning and face-to-face. So it allows us to shorten our courses in the practical face-to-face environment so that you get to self-pace your knowledge evidence at home. So all that theory work that you would normally do on the course, you get to go through and do click and reveal activities, drag and drop activities, do some readings, watch some videos, answer your assessment questions online, but you get to do it in a way that is more conducive to your own lifestyle and your own timeframes. Now, those three modes of delivery, that's us taking feedback from the industry, understanding that there are challenges with trying to attend courses, especially when you are working quite a substantial number of hours. And this is us going, okay, how can we best make it flexible for you to be able to meet the training needs that are out there at the moment? And this is just a bit of a summary of the courses that we have. So provide first aid. It is important. You can see there when we deliver you a provide first aid qualification, you get all 3 units in that. So you do get your CPR re-qualified when you do your first aid so that you don't have to do a separate course. And you can see a 1-day blended only takes 6.5 hours. And we also have the at-home options as well. CPR, you can do it as a standalone unit of competency, 2-day blend, 2 hours, sorry, blended or face-to-face, and then at home, face-to-face and webinar options. I've touched on this briefly. It's the same units of competency that you saw outlined in RJ's presentation for the swimming and water safety teacher. At the moment, it is a 2-day face-to-face course, but we are moments away from releasing a 1-day blended version of that course, which allows you to, as I mentioned, move through the online learning at your own pace, attend a face-to-face session, and do so in 8 hours. We do have update courses available on request. So if it has been a little while since you've done your swimming and water safety teacher and you'd like to redo it, you can request an update course with us. You'll need a group, but it is a really great opportunity just to go back and refresh your knowledge on all of the units of competency and what might have changed since you did your course. Okay, the pool lifeguard has been a bit of a topic of conversation today. So it's a 2-day blended course if you've not completed it previously, 14 hours for the full course or 7 hours for the update, 3 days face-to-face for the full course. And the LSV Aquatic Technical Operator I've already touched on. We are releasing a 2-day blended course or currently a 3-day face-to-face plus an on-the-job book. These are the extension courses for specialists. So the LSV Teacher of Infant and Toddler, you can see a bit of a picture of the training manual there. It is the unit of competency mentioned already. It is available now for bookings. And then the LSV Teacher of People with a Disability that we are hoping to release very soon. And will look very much the same format, a 5-hour course. Now, I've talked about modes of delivery, I've talked about flexible options during COVID, and I've talked about some of the ways that we can be accessible during this period, but I'm very keen to see what questions you guys have, so hopefully I'll be able to assist. Yes, thank you. So you can see Andy Dennis has posted the swim teacher handbook in the chat for anyone who's looking for it. And if you do want to, there is actually 2 pages on our website specific to swim teachers. One sort of goes through the steps of becoming a swim teacher, and the other page is specifically the courses that relate to training, so that you can see all the options outlined. Are the kits available for purchase without completing the course? They aren't available on the LSV website at this stage. I believe you can get them from the Royal National website on their online shop, but I do believe they are looking at adding them to the LSV website soon. It's sort of in progress at this point. So how can we do just the supervised clients and aquatic locations course and not the full lifeguard? Okay, so Lifesaving Victoria is an RTO. There are a number across the state. I'm not aware of any other RTO who offers that standalone unit. That's not to say that doesn't exist, but we have had a look, and at this point there isn't one. What our intention is to do is to actually take that unit or the requirements of that unit and bridge it between the swim teacher course. So it's something we have in development. It's just not something I can offer at this point. As soon as we do have it available, if you are subscribed to the Safer Pools newsletter, we will certainly release it. Sharon, yes, absolutely. I'll send you through my email. Essentially, it's erin.collins@LSV. You can also just email. It's nice and easy to remember, training@lsv.com.au, and you'll always reach me. There is limited opportunities to update the pool lifeguard at the moment. So just so everyone is aware, as soon as a course is full, it does come off our website immediately. And they are filling quite quickly at the moment. So the team are working busily to add as many pool lifeguard updates as they possibly can. At this point, I just keep an eye on it daily because they're just changing at this point. Really good questions. Are there any other questions from anyone? No? That pretty much sums me up then. Thank you everyone for your time. I'll hand back to Michelle.
Thank you, Erin. That was some great information there. We do have one more question coming through from Deborah in the chat. Will you be running some consecutive day pool op courses for those travelling interstate?
Yes. So most of the time when we do deliver the aquatic technical operator, they are consecutive days. The intention for when we release the blended course is that they will run one day after the other. If that is something that you're interested in, the best thing you can do is just email training@LSV. If we know that's something that you're interested in or that there's a particular location, that there's a number of people, we'll keep an eye on that and make sure that we schedule something in the near future.
Brilliant. Thanks, Erin, and thank you, RJ. That was a great presentation from both today. I think I picked up so much new information from that, and I'm sure everybody else listening has as well. As we said earlier, we will be taking a short break from the AFAR series, so we will be returning on the 8th of July with a new format. So we'll be running from 10 till 11:30 with the swimming and water safety education session running from 10:30 till 11. But you're obviously welcome to watch all 3 streams, pool safety and leadership and management included. If you do have any other questions about the series, about swimming and water safety, or about today's session, the school swimming and water safety email is up on the screen, so feel free to email us. Otherwise, that is it for today's session. So thanks again, Erin and RJ. and we'll see you hopefully on the 8th of July. So just remember to finish the session by pushing the red hang up button. Thanks, everybody.
Thanks, Michelle.